infected. I'm a distinguished professor and a research chair in emerging viral threats, One Health surveillance and vaccines in the Infectious Disease and Oncology Research Institute at the University of Utrecht. I've been the chair for the scientific advisory group for the origins of novel pathogens for the World Health Organization since 2021, so the end of 2021. And we're a group of scientists from across the world, from I think it's 27 different countries that all participated in our own capacity. So we didn't represent our country, we represent our expertise, but then to look at the origins of novel pathogens. So this followed after the discovery of SARS-CoV-2, the cause of COVID-19. And we basically had the mandate to firstly develop a template or a framework to investigate any novel pathogen. So if a new pathogen emerged internationally, what steps should you follow in order to define where did it come from? And then this was specifically then applied to COVID-19 or to SARS-CoV-2. And so the paper was basically a follow-up on the report that we wrote to the World Health Organization on our findings of the past 3 years. And so we were invited by Nature to write a commentary on our WHO report. So the WHO report is quite a long and technical report that's not really accessible to the general public and scientists. And so we wrote a summary on that to explain the main findings. We looked at several potential hypotheses. So it's hypotheses that we identified shortly after the virus was initially discovered, and it was by the first group of scientific advisors to WHO in a joint mission that they went to China to specifically go and investigate the causes, and then after that through work of the SAGO as well. And so firstly, the first hypothesis is really that it came from animals to humans, either directly or through bats or through intermediate hosts. And at the moment, this is really still the hypothesis that's most likely to be true. Most of the scientific evidence points to that. But then the other hypothesis includes that it potentially came from frozen goods to China. We don't believe that there's enough evidence to prove this, and at the moment this is not thought to be a viable option. Then the third one is then potentially that it came from a lab over to where it spilled out into the environment and then onwards to the human population. At the moment, the problem really there is that the evidence that we would need to prove this was never really provided to WHO. So they've requested information from China as well as from various other governments, including the United States and from Germany, that had some theories on this or hypothesis, but we never received this, so it was not possible to really investigate this. Then we also looked at the option that it may potentially have been generated, so if it was manipulated in the lab. Most of the evidence that we can find, there's nothing that really shows that it was more likely that it was made in the lab than any of the evolution that can happen naturally in animals or in humans. So we don't believe that is the way that it happened. All the genomic motors and so on that is present that was previously hypothesized that it could possibly be from a manipulated route is not, we don't think that it's true. So at the moment we still believe that the highest likelihood is really that it came from animals. The closest related viruses were viruses, precursor viruses in bats that were identified from China, as well as the Laos, which is close to China. And these are like over 96% identical to SARS-CoV-2. The intermediate host wasn't identified, but various different species was infected following the emergence of SARS-CoV-2. and it basically shows that the virus is really capable to infect various species, and from there on either infect humans directly or potentially that it may have spilled over to humans and then developed mutations in humans that made it more adapted. The initial strains was also all identified, or a lot of it was identified in the Wuhan seafood market. And so there were two different lineages identified here, which also points more to evolution in the animal and then spill over to humans than from one strain that potentially had come from a lab. So that's really our hypothesis at the moment, that it's most likely that it came from animals over to humans. So it's already many years after SARS has emerged, so obviously it becomes more difficult. But some of the things that never really been investigated properly is the animals that were identified at the seafood market. There's no source information, so the tracing of the origins of these animals, where did they come from, where were they bred, some of the wildlife trained, all of these routes needs to be followed to see whether any of these strains could have been identified in the early animals as well. Also people that part of these trade routes in the areas where the farms were, that needs to be followed up. There's still specimens that are collected as part of surveillance programs for severe acute respiratory infections or wastewater in countries. These specimens also can be investigated further to identify what is the earliest time that we could identify virus in population. There were some of the wastewater samples as well as serological samples that tested positive early on, but these specimens couldn't be confirmed in any other lab. So at that stage it could have been contamination because the test was not set up very well yet. So those are the main routes. But in future it's really important also to follow it up very early. We still don't have any information from the laboratories around Wuhan about any staff that were infected. So the record from staff, health records, as well as the biosafety and biosecurity measures that were taken there is also still important. And then various intelligence agencies in the United States as well as in Germany had some leads that they indicated had some information, but this was never shared with us. So we don't, the reports that were published, many of it was not really based on science. It was based more on speculation, personal political views. And in order to really take that seriously, it's important that that data is made available to the scientific community so that we can assess it as well and determine whether that showed any other route than through animals. It's very important in order to be able to prevent any of this happening again in the future. We know that pathogens emerge all the time. We still don't have a clear view of how SARS has entered the human population. And since this virus still keep on mutating, and there's still many similar viruses circulating in bats in Southeast Asia, it's important to know how this occurred so that we can in the future act more rapidly or try to prevent it from happening again. It's very important that scientists work together, that we don't have the politics overrule science. So it's important to stick to the science, to study this internationally, to make data available from all scientists in all countries in order to be able to prevent this. In future, just have a closer collaboration. It's important that we make scientific the sequencing data available as it occurs, but also to give the recognition to scientists that were involved, so that it's not there's not a feeling of distrust between scientists that doesn't want to share data.